Do you recommend people do like extra tricep workouts and bicep even? Yeah.
You know
This is
what?
the personal
I
trainer coming out.
never-
I
That's what
love
I
it,
would
Selah. Go
recommend.
ahead,
No
go
one,
ahead.
To
no
build
one,
that
no
muscle.
one has ever asked me that, but
Really?
it would make sense because the more muscle you have,
Exactly.
it creates a foundation for that skin
To adhere to.
to adhere
Yeah.
to. And so I would say, yeah, working out would probably be really good for anyone who's thinking about having a brachioplasty. And the other thing is, if you plan on losing weight or you want to lose more weight, I would definitely advise that you do it before having the surgery because you have the surgery, you lose a significant amount of weight, you're probably going to create more skin redundancy.
To do it again.
Yeah.
Welcome to Care Experts, a podcast dedicated to empowering you with knowledge for your health and self-care. I'm Melissa, a broadcast journalist.
And I'm Selah, a former fitness coach and personal trainer.
Each week, we interview top wellness and medical specialists from across the country, addressing your questions, even those you might be afraid to ask.
From your fur baby's well-being to skincare secrets to honest talk about bigger health issues, get it straight from the expert.
Join us every Wednesday for insights that will guide you on your health journey.
From cosmetic to dental and vet to vision, this is Care Experts. Today we are talking about brachioplasty or an arm lift.
Yeah, I've heard about those before, but I don't really know what that means. I know it just makes your skin look tighter.
No more chicken wings.
Oh, chicken wings. I love that you just did like the chicken dance.
chicken dance.
Oh my gosh. If y'all are just listening and not watching, you're really good at that.
Well, you don't want your arms to wave goodbye too.
Oh, that
Right?
too. And you want it to look good. And thank
Yes.
goodness we have a double board certified plastic surgeon joining us today to talk all about brachioplasty, arm lifts, and educate us. It's Dr. Nicholas Jones. He is the founder of Nip and Tuck in Atlanta, and he's going to tell us all about it.
Here we go. Hello, Dr. Jones.
Hi, how are you?
Good, how are you?
Dr. Nicholas
Wonderful.
Jones here.
Yes, we are so excited to talk to you today about brachioplasty. Am I saying that right?
You did. Great job.
Why don't you tell us what is brachioplasty?
Brachioplasty, simply put, is an arm lift. So it's removal of excess skin of the arms to improve the contour shape of your arms.
Are you talking about the upper part of your arm?
Yes.
Okay.
Underarm kind of thing, like
Yeah,
chicken wings?
Oh.
Yeah.
Okay.
So basically, it involves making an incision and removing the excess skin. There's various techniques. Typically, I like to try to put the scar in a try to keep it like right in here, so that when you're walking, you don't see. So some surgeons use a scar back here, but I think this is the most inconspicuous place right here.
On the inside.
Yeah.
Yeah.
Wait, does the brachioplasty only target the upper part of the arm, or does it also target that part? Like if you have that fat that's like
Like the bra
underneath your
The
fat?
axilla, yeah.
axilla by
So
your bra? Yeah.
oftentimes, if you have excess skin of your arm, it continues into your armpit. And so you want to typically treat both of those at the same time.
Okay.
And whenever I do brachioplasty, it also involves some liposuction. And the purpose of the liposuction is to debulk the area so that when I do the arm lift, I can take out more skin. However, you want to be very careful not to take out too much skin, because what you'll have is when it's too tight, eventually it's tension on the incision. And as a plastic surgeon, we don't want any tension because tension leads to poor wound healing.
Why would somebody get an arm lift?
Basically, I would say probably the most common reason, you've lost a significant amount of weight, whether that's via like naturally by making some lifestyle changes, or you're a post-bariatric patient, or you've taken weight loss medication. You've lost that weight, and now you have excess skin of your arms. And you don't like the way it appears. When you wear your clothes, it's ill-fitting, or when you have a short sleeve shirt on, you have this loose skin dangling under your arms, and you want something done about it.
And Selah, you're a former personal trainer. You know that you can't get
Can't
rid of
spot
that with
reduce.
exercise.
Right.
Yeah.
Exactly. You can't spot reduce, especially when you said when they've lost so much weight and they have
Right.
this excess skin. There's nothing you can really do. That makes sense. And this is what you do, that you are the founder of Nip and Tuck
I
in Atlanta,
am,
right?
yes.
Can you tell us about how you got started a little bit?
How did I get started? Yes. So growing up, mom always told me I was going to be a doctor. And obviously, you hear something over and over again. people ask you what you're going to do, I say, hey, I'm going to be a plastic surgeon. How did I end up starting my own practice? It's something I always wanted to do. I always wanted to have my own business. And so I opened my own practice with the goal of just providing more patient focused care, improving their experience, and just maintaining their safety without compromising their care.
That's great.
We know that as we age, our skin starts to lose elasticity. Would that be a reason that someone would get, like, let's say they haven't had a dramatic weight loss experience, but they've just gotten a little bit older and they are having trouble toning that area and now there's excess skin? Would age-related brachioplasty be
Yeah,
something that you've seen as well?
that can happen. It's just the amount of skin excess
Okay.
really dictates whether or not you need a brachioplasty. Now, there are some patients who have some mild to mild skin excess where liposuction, just the trauma alone, can cause um, your body to create or to make new collagen, or you may need lipo with a energy device like such as Body Tight or Renuvion, which helps tighten the skin, and the patients may not need the scar associated with a brachioplasty. A lot of times, a turnoff, one of the biggest turnoffs or reason patients may decide not to opt for the brachioplasty is they don't want the scar associated with it.
Is it a big scar?
It's not a big scar, it's just a long scar. I
Oh.
mean, if you hold your arm up, you will have a scar
On the
right here.
inside.
Yeah.
You put it on
And
the
then
inside,
for
yeah.
African Americans or people of color,
Sure.
oftentimes the scars become hyperpigmented, meaning they darken up, which makes them more visible.
I see. So are there non-invasive procedures available if someone wants the results of a brachioplasty?
N-
Not really.
Not really. Like if you have a significant amount of skin excess, there's not much you can do to get that result. If you want a smooth contour of your arm, there isn't anything that you can do. Now, let's say you don't care about how it looks and you want to decrease the circumference, you can use the energy devices. However, the skin's going to look kind of shriveled up.
Are there other non-invasive alternatives to brachioplasty for mild cases? Like, what do you think about cool sculpting
Cool
or
sculpting?
sculpture to reduce excess fat?
So, cool sculpting can be used for fat. I mean, it's cryolipolysis. Basically, it's freezing the fat, your body resorbs it. In the arm, I'm not a big fan of cool sculpting, but it can be used for focal deposits of fat. However, in the arm, it's probably not as effective, but you just have to be very cautious. Um, and I would say just limit for limited areas. It's not for loose skin. Just keep in mind liposuction or any of these other anything to remove fat. It really has nothing to do with tightening the skin.
Removing the excess skin.
Right.
Yeah, that makes sense.
Who would be an ideal candidate for brachioplasty?
Healthy patient, healthy patient, realistic expectations, they scar well. Like if you have a history of keloid scarring or hypertrophic scars, this may not be a great option for you. For weight loss patients, stabilize weight, and if you have any medical problems or conditions, they're well controlled.
Brachioplasties, what's the price range for that?
So price range varies regionally. I would say in the Atlanta area, you can expect to spend anywhere from about 8,000 to maybe 12,000. But it's really not the price that's so important. But just think about like what the value of the procedure. Like you have these patients they've been on this weight loss journey or they've had this excess skin all their life, and now we're able to do something that's going to be life changing. You're going to be able to fit your clothes. You can go out publicly and not be ashamed. You don't have to wear this long sleeve shirt anymore.
Yeah, that sounds life changing, right? It's a transformation.
It
really.
is.
Yeah.
It's totally a transformation.
So does someone pay for it through insurance ever? Or what are some ways people can pay for it?
That's a great question. There's probably a few insurance companies that pay for post-bariatric surgeries, but in general, this is a fee-for-service procedure, paying out of pocket. cash, obviously, credit cards, but there's also financing options. And one that, is pretty common amongst in the plastic surgery arena is a CareCredit credit card. Simply fill out an application online, takes a few minutes. You find out whether or not you're approved, and you get the surgery and pay over a period of time.
That's so great.
Yeah.
And
How can that be? How impactful is that for you as a surgeon to be able to offer somebody a service, them to say, "Whoa, that was more than I was expecting," and then you to say, "Well, here's an option for you
Mhm.
to pay this off over time and continue on your journey to transforming how you look and
Mhm.
feel."
Yeah, it's a game changer because, for the most part, most of my patients are everyday, like working class people.
Hmm.
Like we all go to work for a living. We have other financial obligations. And, I think by being able to finance the procedure, it allows me to take care more people and, offer my services. And also for the patients, it also gives them the opportunity to maybe get something that they want done without having to wait a long period of time
Mhm.
because they don't have to save up, or put off this trip to get this done.
Exactly.
Yeah.
Do you consider genetics? Does it play a role anyway in whether or not someone has excess skin? And is it more common for women to have it or for men?
Great question. I think your genetic makeup definitely has plays a role in your ability to heal and also your skin elasticity. I mean, just like any other part of your body. I mean, both of you have great cheekbones, so you're probably going to have your face is probably going to look great forever.
From your lips to God's ears.
Okay, thank you, Dr.
Absolutely. And
Jones.
so just the same thing takes holds true for the for other parts of your body. So the genetic makeup does have a role, but also your diet, like weight fluctuations. If you have large fluctuations in your weight, you're more likely to have skin excess.
That
And
makes
for
sense.
men and women, is it the same, are you saying,
Um,
or does it vary?
it I would say it varies, but I would say women more so than men.
Maybe women also are more motivated to take care of it. I
Yeah.
feel like we don't want those chicken wings. Yeah.
Yeah,
No,
women,
you
I
want to
would
look
say
good in your
most of my
swimsuit.
patients are women. Yeah.
Yeah, that makes sense. What's the importance of choosing a board certified plastic surgeon like yourself?
Right.
Double board certified.
Great question.
Mhm.
So, board certification basically means that I've sat before my peers and we've gone through a battery of testing, and it's just to ensure patient safety. And not only that, there's certain requirements or certain things that I have to do in order to maintain that certification. That includes continuing medical education. I have to have admitting privileges at a hospital. So in the event that you have a complication, I have to be able to admit you into a hospital, as opposed to, let's say I did your surgery and I am a neurologist. Let's just say I'm a
Right.
neurologist. I'm doing liposuction or I'm doing an arm lift in my office and something goes off. You go to the emergency room. I can't take care of you in the emergency room or that facility because I'm not a plastic surgeon.
Mm,
So yeah, it matters. It's important.
that makes sense.
So we've talked about the cost of brachioplasty. We've talked about who's a good candidate for brachioplasty. What is the extent of the procedure itself? Like, are there different types of incisions that you would make depending on the individual? Is there like a longer scar some people are going to get just depending on their own circumstance?
Okay. Yeah, that's a great question. So there's typically two major approaches. One is the scar that's in the underneath the arm,
Okay.
and oftentimes is extended into the axilla. Sometimes there's what we call a sharp scar brachioplasty, where you just take some skin from underneath the arm and it helps kind of tighten the arm up, but it's not really addressing the laxity here. I personally don't like this one because over time it puts too much tension here and it
Oh, right.
oftentimes fails. As far as the other than that, I mean, some surgeons may place a scar posteriorly or behind the arm. I personally don't like that because it leaves a visible scar when you're in repose position. And again, I mentioned this earlier, I always do some form of liposuction. So the liposuction is really to debulk the area so we can take out more skin. And I also use what we call a avulsion technique. So let's say I make an incision to take out the ellipse of skin and fat. And so once we make that incision, I just kind of rip the tissue off.
Sounds scary, Dr.
Yeah, it sounds
Jones.
scary, but the
I
purpose
hope
of
so.
doing that is you preserve many the lymphatic channels. And so
Oh.
that's important because you have less swelling after and your arm you heal faster.
Oh, okay. Good to
Yeah.
know.
But you can still flex and everything, right?
Yeah,
Like
every
eventually.
every
Well, I'm
every
just wondering.
Yeah,
I work
yeah,
on
yeah.
these biceps and these shoulders. I
everything
want
is
to be able
intact.
to
So you
still
just it's
flex.
just
Your
fat.
muscles
It's
intact.
just
Yeah.
fat and
Okay.
skin.
Fat and skin.
Okay.
Makes sense.
Okay.
So when you go to a brachioplasty surgery consultation, what can you expect? What should it look like?
So we come in, we meet, we go over your past medical history, your surgical history, allergies, medications. First, I want to identify what your problem is, and we need to identify whether or not I can help you. Once we figure that out, we need to determine if it's safe. And so that's when your history comes into play. And once we determine that, then we go over some options. And go over the options. We agree on the option. I met your expectation. You've met mine. And then, of course, before we do the surgery, we have to get some lab work done just to make sure that it's safe for you to have surgery. And then I want to know what your support system's like. Can you do what you need to do after surgery? And simply for a brachioplasty, it's not much. The compression is really important. And the reason compression is important, help out with the swelling, help out with the healing. And also it helps relieve some of the tension off of the incision. Because as a plastic surgeon, we don't want any tension on the incisions.
You keep saying that. I can tell. Like that's
Yeah.
really important.
Tension on the incisions lead to scars spreading apart.
Okay.
Scars spreading apart, ugly, nasty looking
Yeah.
scars. We don't want that.
And the compression is just around the arms.
Yeah, it goes a little bit past the elbow.
Okay.
You need to wear that for about 2 or 3 months.
Oh, 2 or 3 months. All day?
Yeah,
24/7?
yeah.
Wait,
all
like
day.
even like in the shower and stuff. You just leave
No,
it.
no, no, no.
I
You can
don't
take
know.
a shower. I want
Are
you
they
to take
waterproof?
Like
No, you can take it off to take a shower.
Okay.
Okay.
Because I want you to clean. I want you to keep it clean because
That's
we don't.
important.
If you're not cleaning it, it's going to put you at risk for infection. So
Sure.
let's keep it clean, and then we're going to moisturize your scars because healing wounds love moisture. Moisture helps with the healing process.
Okay.
Okay.
And then I'm a big fan of silicone-based products.
Oh,
So
for
silicone
scars.
on the scars do amazing work.
Yep.
Silicone and just moisturize, whether it's cocoa butter, bio oil, aloe vera, just moisturize that incision.
Okay.
Yeah.
By the way,
much.
how long should someone take off of work
Yeah.
after a
For a
brachioplasty?
brachioplasty, probably like I would say about 3-4 days.
Okay.
Because again, mostly with as a plastic surgeon, we're just operating on soft tissue. Like it's not brain surgery.
Okay.
You can have complications, but usually they can be managed as an outpatient. And so for this procedure, specifically, like 3 or 4 days,
Okay.
you probably have some pain. You want to limit your physical activity. You don't want to do any heavy lifting. You don't want to be lifting your arm, doing like
Bicep
overhead.
curls.
Yeah,
Yeah.
bicep.
When can you resume those normal lifestyle activities? If you
Yeah.
are a gym rat?
So pretty much for any procedure, I usually tell patients like about 4 to 6 weeks.
Okay.
And then once you get back if you're a gym rat, you don't want to go back to the gym full throttle. You want to kind of gradually
into it.
ease yourself into it.
Okay.
And can you do a brachioplasty in combination with other nips and tucks?
Wow, yeah, that's a great question. Yes. Yes, you can, just as long as it's safe. And what I basically I want to make sure I'm not going over a certain period of time. and depending on your underlying medical conditions, the setting in which we're doing the procedure, and also what procedure am I combining. So if I'm doing an arm lift, I don't want to really operate on your legs because I don't want to render you immobile and you
Right.
can't really take care of yourself.
That makes sense. Okay.
How long does it last after you get a brachioplasty and you've healed and everything? Are you now like, oh, I'm good. I never have to worry
Forever?
about, I never have to worry about wings again. Yeah.
Right. Well, as we age, there's nothing that, I mean, over time, aging is aging. But I
Right.
think for the most part, if you're able to maintain your weight within a certain parameters, you really shouldn't. It should be life lasting.
Do you
Oh, okay.
recommend people do like extra tricep workouts and bicep even? Yeah.
You know
This is
what?
the personal
I
trainer coming out.
never-
I
That's
love
what I
it,
would
Selah. Go
recommend.
ahead,
No
go
one,
ahead.
To
no
build
one,
that
no
muscle.
one has ever asked me that, but
Really?
it would make sense because the more muscle you have,
Exactly.
it creates a foundation for that skin
To adhere to.
to adhere
Yeah.
to. And so I would say, yeah, working out would probably be really good for anyone who's thinking about having a brachioplasty. And the other thing is, if you plan on losing weight or you want to lose more weight, I would definitely advise that you do it before having the surgery because you have the surgery, you lose a significant amount of weight, you're probably going to create more skin redundancy.
To do it again.
Yeah.
Are there ever touch-ups that are necessary?
Yes,
Oh,
yeah,
okay.
yeah. I've had to do touch-ups on my patients, and I've also done touch-ups or revisions on other surgeons' work. Yeah.
what does that entail?
So it really depends. Like sometimes it's the scarring.
Mm.
Like I said, it's a high tension area, and so if you have had surgery and your surgeon took out too much skin, the scars spread apart. And then over time, it kind of softens up. And there's been times where I've been able to revise the scar in my office, and sometimes it's just been a complete revision of the brachioplasty where we just do the whole surgery over, whether that's from scarring or they gained weight and then they lost more weight.
I see.
One of the things I love about you, Dr. Jones, and the brachioplasty work that you do is you saying you put the scar on the inside, or rather the incision on the inside. So
The bicipital
Yeah.
yeah,
groove.
so it's more
Uh-huh.
minimal. It's more minimal and harder for people to see unless you're actually raising your arm up.
Right.
Let's say I'm a patient who has moved, who is fully healed.
Uh-huh.
I've achieved my optimal results. So I'm no longer wearing the compression garments.
Mhm.
And I want to go show off this new body
Yeah.
because I feel really good now, right?
Right.
How do I continue to protect that area so that the elasticity stays intact I mean pretending that Father Time isn't going to catch up with me eventually. Yeah. Like
I-
sun protection, or is there anything special like that I
think
need to do?
just, I mean, the same way you would take care of any other part of your body. You want to just have a regimen, moisturize, and sunscreen,
Okay.
and exercise. Yeah.
And that silicone scar stuff.
The silicone
Right.
scar stuff. So typically, for any scar, it takes about 6 months to a year for a scar to completely mature. So if you're using that scar cream and you're moisturizing, probably the most critical time is probably the first 3 months. So
Okay.
use a moisturizer, use the scar cream, and it'll help optimize your results.
Oh, it's good to know.
All right, Dr. Jones, it's time for Ask the Expert. This is
Ask
when
the
our
expert.
Yeah, you're the
Yes,
expert.
you're
You're
the
the
ex-
expert. Yeah.
Yes,
Yes,
you.
it's you. So this is when our audience gets to ask you questions. They
Okay.
get to submit these anonymously. Here's the first one. Is it possible to have an arm lift without visible scars? What can I expect in terms of scarring?
Yes, so you can have an arm lift without the visible scar, and that's, as I mentioned, a limited brachioplasty where you're just taking a ellipse out underneath in the armpit. However, not all patients are candidates for it. I personally don't offer that surgery because I don't think it's very effective, and over time it's going to fail. So if you're not okay with the scar, then it's probably, I mean, then brachioplasty really isn't an option for you.
Okay.
Now, there are some other options depending on the amount of skin excess you have. If you want your arm to look smooth and you want to get rid of all the loose skin, brachioplasty is probably the only option. But if you're okay with having bunched up, crinkly skin, you can do liposuction with skin tightening, but it just doesn't look as good,
You're
in
not
my
getting the
opinion.
same results.
Right.
Right. Okay. This next question is, I have a few tattoos on my arms. Will the surgery greatly impact the look of them? If so, how soon after can I get them retouched? Wow, good
Great
question.
Thought
question.
about
Yeah, I didn't
that.
either.
It depends on where your tattoo is. If your tattoo is encompassing the area where we're removing the skin, it will definitely affect the tattoo.
Mhm.
How soon after surgery can you get a tattoo? I would say about 3 months.
Okay.
Yeah.
Wow, interesting.
Dr. Jones, is it safe for me to get multiple arm lifts throughout my life?
Hmm.
Yes, it can. It is safe. However, every time you have a surgery, your body's going to create scar tissue. So every time you create a scar, it can alter the anatomy. And the more scarring you have, the more difficult it is to go back. And I would say 2 or 3 at max because every time you have an arm lift, you have to have some loose skin. If there isn't, I mean, if there isn't any skin to remove, then what are we really doing?
Right.
Yeah.
That makes sense. Okay, this person asked, can you still get an arm lift with a birth control implant in my arm?
That's a good question.
I've never
Yeah.
heard that
Thought of that
before.
either.
Yeah.
Yeah, I would assume you can. I personally if I was in that situation, I would consult with their OBGYN
Right.
just to make sure, hey, can we get this removed first? I would probably have them remove it and then maybe place it somewhere else.
Hmm.
And then I would give them a chance to heal before we decide to do the brachioplasty.
That makes sense.
Hmm.
Yeah.
I just had never thought about the tattoo one though.
I
I
never
like
did
that question a
either.
lot because you do see people with like sleeves, right?
Mhm.
So,
Yeah.
I mean, obviously your tattoo's look would be
It
compromised
would.
if they're removing the excess skin,
Have
right?
to redo it. Yeah.
Yeah.
Definitely. Wow.
Was there anything we didn't ask you about brachioplasty that you would want to share, like the success stories or where you've seen it really make a difference in someone's life?
Yeah, I think it's a great operation for patients who have moderate to severe skin laxity. Make sure as a patient, do your research, get to know your surgeon, meet your surgeon, write down all the questions you have, and I think you have to feel comfortable. Like I have to feel comfortable with you as a patient, and you need to feel comfortable with me, know what to expect and if I meet your expectations and vice versa, then we can cook.
Yep.
You do the
Absolutely.
cooking.
Yeah. Yeah.
I'll just bring the ingredients. How about that?
There you
Absolutely.
go. Boom. That was good.
Thank you. I'm pretty quick. Dr. Jones, such a pleasure to have you today on Care Experts. We appreciate you.
Thanks
Thank
for
you.
having
Thanks
me.
for being here.
Absolutely.
Mm.
Thank you so much for joining us and being part of our growing community.
Stay tuned for new Care Expert episodes every Wednesday. And don't forget to subscribe on your favorite podcast app and YouTube.
The CareCredit credit card is subject to credit approval. The information, opinions, and recommendations expressed in the episode are for informational purposes only. Information has been obtained from sources generally believed to be reliable. However, because with the possibility of human or mechanical error by our sources or any other, Synchrony and any of its affiliates, including CareCredit, collectively Synchrony, does not provide any warranty as to the accuracy, adequacy, or completeness of any information for its intended purpose or any results obtained from the use of such information. All statements and opinions are the sole opinions of the doctor being interviewed. The data presented in the episode was current as of publication. Please consult with your individual advisors with respect to any information presented. All product, service, and company names are the trademarks of their original owners. The use of any trade name or trademark is for identification and reference only, and does not imply any endorsement, sponsorship, or affiliation by or with the trademark holder of their brand.